Yep. And that's why I don't drink whole milk anymore. But it is very nice to see you again, Dr. Gerald. I'm glad you were able to come in and join me in my athletic training room's office. Yes, come here. Come in.
Hi, Drew.
Yes. Oh, how you doing, Drew?
Hey, Doctor.
Is everything okay?
Yeah, don't kill me, but I was playing soccer today at practice and I rolled my ankle.
Okay.
Is there actually a place I could sit?
Yeah, you can sit right over here. Actually, this is my friend, Dr. Gerald.
Oh, hey, Dr. Gerald.
Okay. All right, well, just have a seat. Do you mind if I talk to him a little bit? All right, thank you. So what seems to be going on?
Well, like I said, I was just at soccer, and I was playing midfield position, and so that means I get to, attack, try to score, and as I was doing so, I tried to shift, I guess, too quickly. I don't know, what would you say, momentum carried me. I tried to go the other way, and I rolled my ankle.
Just trying to be an all-star?
Basically, yeah.
Okay, okay.
Yeah.
Well, are you just coming in to see if I can do anything for you? You want me to check it out?
Yeah, it just hurts.
Okay.
So.
Okay. Well, I was actually explaining to Dr. Gerald about medications, so do you mind if I tell you a little bit about non-steroidal anti-inflammatory drugs?
Can that help?
It can. Let me explain throughout the entire process of it. So, NSAIDs, that's the abbreviation for non-steroidal anti-inflammatory drugs, are actually the most commonly used and frequently prescribed drugs. So, what kind of pain would you say that did you say that this just happened?
Yeah, it was just today.
Okay, so...
Like a few hours ago.
Okay, so it's not chronic, because that happens over the course of about 6 months or longer. This is more considered an acute injury.
So, like, sudden?
Yes.
Okay.
Yes. Okay.
Gotcha.
If you have any questions throughout this, just be sure to just ask me.
Okay, well, I'm kind of skeptical towards medications. Is it really going to help? Like, will it allow me to, return to play quicker? Or, like, what's its responsibility?
Well, research has shown that although it's clear that NSAIDs reduce pain and inflammation, it's not clear whether they decrease the healing time to allow for quicker return to play. So, basically, actually, aren't you an exercise science student?
Well, yeah.
Didn't you have prevention and care?
I did.
You did? Who was your teacher?
I took Dr. Armstrong.
Dr. Armstrong. Okay, well, Dr. Gerald teaches as well, and I would say that she teaches inflammation very well. So, do you remember the inflammation process?
I remember there were 9 squares.
Okay.
I think that's all really Dr. Armstrong went over. I think he just said there were 9 squares and we moved on to the next thing.
Okay.
I was literally confused.
Dr. Gerald did a better job. You would have learned a lot more. But basically, inflammation is a process. And much like any other process, it goes from start to finish. Now, if you were to take NSAIDs, then part of that abbreviation is anti-inflammatory.
Sure.
Because the process is the inflammation process. By saying anti right there, it's kind of slowing down the process, actually. So there are going to be short-term benefits. Those benefits, you're going to be able to return to play quicker, you're not going to feel the pain, you're going to be able to get on it faster.
So, like, they slow down the process of the inflammation?
Well, like I was saying, the short-term benefits are you'll be able to get the pain will be reduced, but the inflammation itself is that process, and it has to go through the entire thing. So by putting that anti in front of it, and by the actual chemicals and drugs that are acting on your body, it's slowing down that process. So the long-term is actually long-term almost problems. But the short-term, if you were to play like tomorrow or in 20 minutes or 2 hours, I would say, yes, some aspirin, maybe ibuprofen would be good for you. But if it's going to be a few days from now to a week from now, we'll probably just do what you learned, the RICE method, rest, ice, compression, elevation. So those are the short-term versus the long-term.
Okay. Well, it is just the weekend now, so, I'll practice for a few more days.
Okay.
Yeah. Well, we talked about benefits, but, what I'm wondering is, are there any adverse effects or, risks that are associated with NSAIDs?
Yeah. There are adverse effects. The most common adverse effects, and these sound bad, I'll kind of break them down in a second. as do any adverse effect. When you listen to the TV and they freak you out with the like really fast adverse effects.
Sure, they have to say fast because there's so many things.
Yeah, exactly. Well, I'm not going to say this fast to you. So, you have GI tract, your gastrointestinal tract. You can have bleeding, irritation in there. You can have heartburn, nausea, ulcer-related complications. These being more bleeding, perforation, obstruction, and ultimately, if it's done in the wrong way, like if you're underestimating the effects that this can have, it can lead to death. There's actually an estimated 16,000 deaths a year contributed to anti-inflammatory drugs, and about 100,000 hospitalizations. But no need to fear. Athletic trainers here, and I'll be able to take care of you a little bit better because I'm not underestimating what's going on with you. And you mentioned, are there more risks to it? Like, is there? Are you asking like, what would put you more at risk? Is that what you're asking?
Sure. Like, when are the risks the greatest? I guess.
Oh, okay. The risks are greatest in people over 60 years of age.
Okay.
You look like a fine, handsome young lad. I don't think that's your problem.
Thank you.
And actually, if you had a history of pelvic ulcers in your family, do you have those?
Not that I know of. Although it sounds kind of awkward. Maybe I just haven't told me.
No, I think they would have told you because there's a lot of medication going on. But if we need to check more into it, then we will. Patients who use corticosteroids, are you on any of those? No. Anticoagulants?
No.
Okay. And are you a binge drinker?
I am not.
Yeah, I didn't think so.
Yeah.
From your other friends, I didn't think that they were. And do you smoke any cigarettes? Marlboro?
No, I don't.
Alright, it's very good.
Yeah.
Like I said, healthy young man.
I like to run.
There you go. I mean, that kind of goes against those. So
right.
There you go. Well, you have any more questions? I think we're kind of going right down the list. Is there anything else?
Well, so they're like pills, right? Or okay. So I've heard the need. You gotta eat food for other medications. Do I need to do the same? With this?
Yeah.
Or drink water or anything?
And the pills, it would be pills are the most common form, but there are other forms, topical and a few more. But if you're going to be taking the pill, if you're taking the pill form, then yes, it would be good to drink water, eat some food. If you're going to be going into a game, might I recommend some carbs that they might be able to help you out with your glycogen not being depleted as fast, and the water will keep you hydrated. So, yes, drinking water and eating food is a good thing.
So not necessarily bad, but why not, right? Like, just go and do it.
Yeah, exactly.
Sure.
Now, did you say that you're not going to play for a few days?
Yeah.
Okay, well then, I would, in light of everything that I just told you, I think that Dr. Jill and I would agree, and that it'd probably be best for you not to take the anti-inflammatories right now, but instead go home, rest, grab a bag of ice, just kind of put that on your ankle. It seems like there is a little bit of swelling coming in, and then just rest it for a few days.
Get some elevation in there.
Get some elevation in there, and compression if you got some like really tight socks.
Okay.
Yeah. Do you have like ice at home, ice bags?
Yeah, I mean, this is an ice maker, so.
Okay, well, little trick, this is what I kind of do. If you want to save yourself the time and energy, then just go to Kroger someday and either buy a bag of peas, frozen peas, or a bag of frozen tater tots. Just keep those in there, write 4 injuries on there, put like a skull and crossbones on there if you want, biohazard, I don't know. And then anytime you're injured, just throw that on there.
Yeah.
Sound good?
I mean, I usually need those too, like I'm hungry later.
Yeah, maybe. That's your call.
Yeah.
Alright, well, I'm sure that me and Dr. Jill have some more conversations to attend to, so is there any more questions you have?
I mean, no, that's pretty much it.
Alright, sounds great, Drew. It was wonderful to help you out.
Thanks.
I should come in a few days and we'll check up on that.
Okay, sounds good.
Alright.
See you, Dr. Jill. Congrats on the baby.
Alright, see you later. And that is anti-inflammatories. Public service announcement.